The next step in terms of use of radioiodine is we're now considering whether we really can identify a subgroup of these patients who actually don't need to have radioiodine treatment at all because their prognosis is so good that it's really not necessary. So the same group that ran the HILO trial are now running another trial known as the ION trial, which is investigating whether this, say, a carefully defined group of low-risk patients may get away without having radioiodine at all. So most patients with thyroid cancer, as I've said, probably 90–95% fall into a good prognosis group for whom the chance of cure is very high with surgery and radioiodine, as we said. Unfortunately, there's a small group of around 5–10% who develop more advanced disease that doesn't respond to radioactive iodine. This is known as radioactive iodine refractory disease. And for that group of patients, the treatment options have historically been much more limited. There are now some oral targeted agents that are available for that group, but one of the things that our group are investigating is whether there may be a class of drugs that can actually resensitize thyroid cancer cells that have become resistant to radioiodine to become sensitive to that again. And this is a trial known as the SELIMETRY trial that's running around in a number of centres in the UK, seeing if we can get the benefit of radioiodine therapy back to these patients who have become resistant to it.